But first, it's time for a visit to our doctors. Now, October is Breast Cancer Awareness Month, where campaigners help to wake us up to the startling statistics of those affected. According to breast cancer care charity, around 55,000 people in the UK are diagnosed with breast cancer each year. That's one person every 10 minutes. Here with their tips on spotting the early signs, our trio of doctors. Please welcome GP Dr Anita, dietitian Lucy Jones and plastic surgeon Dr Dirk Kremer. Nice to see you, Anita. So, important that we have this month to raise awareness.
Absolutely. It's essential to raise awareness. The reason why breast cancer is the most common cancer in the UK. As you mentioned, scary facts, 1 in 8 women will get breast cancer at some point in their life. But it's not just women. Men can get breast cancer too. I think around 400 men every single year in the UK are diagnosed with breast cancer.
And it's worth talking about. It's
Absolutely.
good, isn't it, that it's been brought out into the open.
Yeah.
It's less of a taboo subject.
A lot of people are scared to talk about breasts. They hide them away. So the whole point of today's show is actually to get people's confidence in checking themselves. Also going to see your doctor if you notice something that's different to your normal breast tissue.
Well, fronting one campaign is Jill, who's here to share a story. Please welcome Jill Hindley. Welcome, Jill.
Thank you.
Lovely to see you.
Thank you.
So, Jill, tell us your story.
Well, my cancer was picked up by a routine mammogram and just over a year ago. And so I had a mastectomy and I had chemotherapy and a treatment called Herceptin, which I'm just coming to the end of now, so I've got one more treatment to go.
So you're a year on and feeling fine?
Yeah, I am feeling fine. I've had my moments,
I bet you had your moments. You've been incredibly brave because you're fronting this campaign with a picture of yourself on a poster. Now, this might startle a lot of folk. Did you think very long and hard before you agreed to do this?
Yes, I did, but I was very happy that I've taken part in it because when I was diagnosed, I went to find images of what I'd look like, and there weren't many out there. Obviously, my breast nurse did show me a photo, but I feel it's really good to raise awareness of the impact that it can have, because breast cancer affects, you know, your femininity, you're feeling attractive, and I just thought, well, you know,
Sharing it with other folk helps. It
Yes.
gives a lot of other people confidence. Will you go for reconstruction at some point?
Perhaps. I know it's available to me in the future.
But you can decide when you want to do it.
Yes.
No rush.
No, but at the moment I'm very happy with my body, and you know, because I'm older, perhaps if I was younger I might consider reconstruction, you know, more, you know, but at the moment I'm very
You're happy
confident.
with the way you are?
Yes.
You're happy to be here?
I am,
Well, that's
absolutely,
good.
yes.
Well, Anita's going to show us how to do a breast check on one of our viewers, Nicola. Nicola, come and join us. And you can show us, Anita, and as you say, men as well as women.
Absolutely. So men should also pay attention to this too. So Nicola's kindly come on the show today. Nicola has a story as well. Maybe you could tell us what happened with you, Nicola.
Yep. Earlier this year, I discovered a lump under my arm while I was training, exercising. Left it for a couple of weeks and it was getting bigger. So I decided to go to the doctors. They referred me for a scan. Luckily, it turned out it wasn't breast cancer, so I was very nervous.
Yeah.
So this is the message, really. If you notice anything different with your breasts, go and get yourself checked. 9 out of 10 breast lumps turn out not to be cancer, but it could be cancerous, so you shouldn't ignore it.
Either way, you want to know.
Absolutely, yeah. So at least a third of women don't check their breasts, so we're just going to run through quickly what you can do at home. Standing up or lying down, I find it better to be stood up in front of a mirror. So if we imagine Nicola's stood in front of a mirror, first thing women should do is raise their arms above their head. And you're looking at yourself in the mirror for signs of asymmetry in your breasts, any dimpling or puckering of the tissue, any inversion of the nipple. Then you put your hands on your hips, press in firmly, and you do the same checks again, just looking for anything that looks unusual.
So you're looking for symmetry, basically?
Asymmetry, something that looks different from one side to the other.
So you want symmetry and
breasts are
asymmetry.
naturally asymmetrical, but you're looking for something that seems different from your normal breast.
Right,
OK? And then it comes to the important bit, which is actually feeling the breast tissue. So, Nicola, if I get you to raise your arm above your head on this side. So the best way of remembering how to check the breast is to think of the breast like a clock face. So 12 o'clock, 3 o'clock, 6 o'clock, 9 o'clock. You use 3 or 4 fingers on the opposite hand, place them firmly on the breast, and then you do a circular motion all the way around the breast tissue. And you're feeling for lumps or any thickening of the tissue. So you make sure you cover all of the areas, and also including the armpit. A lot of people don't realise that breast tissue also goes up into the armpit too. Once you've checked your breast, you also have a feel around the nipple for lumps, and give the nipple a gentle squeeze to check for discharge, because any blood-stained discharge could be a sign of breast cancer too. Right. So I'm just going to let Nicola try on the other side. If anybody does a check at home and notices a lump, first of all, don't panic, because 9 out of 10 breast lumps don't turn out to be cancer.
But just go to your doctor.
Go to your doctor, get yourself checked, and early diagnosis could save your life. So this is what we're trying to promote today.
Lucy, anything we can do with diet to, you know, ward it off, to prevent, or...?
Yes, absolutely. There's been a lot of media attention about the genetic risks of breast cancer and how it can run from mothers to daughters and granddaughters. But actually, there's a lot in your environment and your lifestyle that can determine your risk as well. For example, being overweight or gaining weight throughout your adult life is quite strongly related to breast cancer risk. And there's certain things in your diet, all my normal advice, like Mediterranean diet, high fibre, low fat, we've heard it all, but it counts. Yeah. However, there's been a lot of controversy about the advice around soya and breast cancer. And that's because it was thought to mimic estrogen. But actually, the most decent research out to date shows that it could actually be helpful in terms of breast cancer risk, particularly for postmenopausal disease. And booze, minimal, because, of course, just 1 drink a day in women increases risk by 82% of estrogen receptor-positive breast cancer.
Wonderful. Thank you, Nicola. Bless your heart. So, in the papers today... Anastasia has revealed she's recently had a double mastectomy, which is something our next guest has also undergone. Please welcome Heidi Raymond. Heidi. Now, Heidi, tell us your story.
I was diagnosed 5 years ago when I was 35. I found a small lump in my right breast. I went to the doctors immediately, and within 3 weeks I had a mastectomy and underwent radiotherapy and hormone therapy for 5 years. I waited a year till I had reconstruction, and I was absolutely over the moon with it. But unfortunately, my cancer came back into my chest muscle a year later. But then I had the joy of having another reconstruction a year later and feeling like I do now, really.
And now you're fine?
Yeah.
Wonderful.
Yeah.
Dirk, this is something that people, you know, Jill's thinking about it too, about reconstruction. What does it involve?
Exactly. We have basically 2 major types of breast reconstruction. One case is we can use breast implants. It's the most simple procedure, and usually is just involved if you want to reconstruct a smaller breast. Yeah. The other possibility is that what she chose is to use own tissue of the patient.
So it's tissue from whereabouts on the body?
Tissue can be taken, we talk about fat, skin and muscle. It can be taken from the back. In her case, it was taken from the back and it left her a scar. Maybe I can show that to the patient, to the audience.
So can we see that? It's hardly...
It's that. Yeah. And they're built in combination with the breast.
Don't worry about the microphone.
In combination with an implant, they built an amazing breast. And I've seen before the show her, she told me the breast, it's stunning. Yeah. 3 months after the breast reconstruction, they tattooed and reconstructed her nipple. Yeah. It is really amazing. Symmetry is there. I'm stunned.
And this mattered a lot to you, Heidi, clearly.
Yeah, your femininity, I think in the days that were quite low, to have some hope of knowing that, although everybody else could see me looking normally, to me, I knew.
One thing, because really, she looked stunning. She really, I'm very thrilled with her result. Yeah. This is the message today of the show. Medicine is so advanced today that we really can fight cancer. Yeah. The surgery, everything is great. But most important is, again, Anita said it, early diagnosis, and women out there, look for a lump almost each day, each week, on a regular basis, and then we can have this result, this patient here.
Lovely story there, and great. Thank you, Jill, for being brave enough to do what you've done. It's going to listen to us all. Don't forget, if you're considering plastic surgery, always do